Hey everybody, it's Dr. Ozzie with the Functional Medicine and Wellness Center. Recently we've had a lot of questions from patients about the functional blood chemistry analysis that we do. Basically who should do it and why. The WHO, people who have a disease and or people who have been to their primary care physician, have had some blood work done because they don't feel well and the doc says you're within the norm, we can't find anything wrong with you, even though they don't feel well. Those are the people we'd want to look at. The reason we'd want to look at that is because we analyze the blood work differently with functional blood chemistry analysis. We use different parameters for our norms. You might be surprised to know that where we get our norms or our reference ranges are from a bell curve for the people walking into that particular lab that you went to. The sicker the population going to the lab, the wider the ranges. Sounds kind of crazy, but that's how it is. So most people who go to lab, they don't feel well. That's why they're there. They're sick. So again, those reference ranges get wider and wider as the population gets sicker and sicker. So you may be healthy or you may be just as sick as the next person. That's why you have the symptoms. So when we look at those numbers, we kind of crunch them down and go, this is functional or what we consider normal. This is dysfunctional and this is disease, and that's where our reference ranges start from. So we're concerned with the stuff that precedes disease and not just with looking at disease. A lot of times when we do that, we can find a lot of things that we can implement, some kind of treatment plans or protocols for people to get better, or at least try and help their body balance itself when we're outside of those functional ranges, which are leading us into dysfunction, into symptoms, or eventually into disease. Again, we want to focus on the patient as opposed to the disease. So the patient with the disease, not the disease with the patient. So that's why we want to consider functional blood chemistry analysis. We're going to try to do that online with Skype as soon as we can, so that we can talk to people from all over the country and give them some information about their blood. If you haven't had anything done in the last 4 months, we can advise you on what we would do. It's a wellness panel. It's quite large, about 3 pages, but it really gets into the foundations of what could be a problem with people, and then we go from there. If you don't want to go through us, we would send you back to your primary care physician, and then again just send you an email with the information we'd want done, and then we can analyze it with you in about a 20-minute appointment. If you go to our website, functionalmedicinecenter.com, you can look at functional blood chemistry analysis and the differences between the pathological or disease ranges and the functional ranges, and you can actually get 20% off our initial eval for the functional blood chemistry analysis. I hope that answers the questions. I hope you have a great day, and we really hope we hear from you. Thanks. Bye.